Hi, I'm Dr. Ahmedov, hair transplant surgeon at Smile Hair Clinic. Today, I would like to talk with you about the specific topic, hair transplantation in females. Just like in men, we see the hair loss in female very frequently, and it's a known fact. But unlike the man, the hair loss pattern in females can go slightly different. The first thing we always do for the female patients is the careful evaluation and medical history. Because there can be different reasons for the hair loss, genetic factors, hormonal change, pregnancy, some other diseases. So we need to diagnose and find out the reason why the female patients are losing the hair. After that, just like in all the surgeries, there are 4 basic steps. Step number 1, planning. The planning is done very thoroughly and carefully because the hairline is drawn differently, it's more rounded, it has some specific features that we see in females. Number 2, we evaluate the donor area. The donor area evaluation is also very crucial because most of the time for females, we do a partial unshaved surgery, or sometimes called the window technique, when the small patch at the back of the head, depending on the number of the grafts we need to get, is shaven and the grafts extracted by the FUE technique, meaning that each hair follicle is extracted one by one. After the extraction is over and we have the number of the grafts, step number 3 is the incision or creation of the new channels or small holes where the grafts will be lodged. It's an accurate process. Angle, direction, distribution is very crucial so the hairline and outlook of the patients look natural and actual. Finally, after the incisions are done is the implantation. Implantation means the placing of the extracted grafts into the newly created incision sites. So after all the steps of the surgery are performed, the surgery is done. It's not known widely, but hair transplantation is carried out very widely for female patients as well. There is a known fact that 1 out of 4 female patients have some degree of the hair loss, and when we go above the age of 40, this ratio is gone up to the 50%. Hair transplantation surgery can be carried out safely, naturally, and efficiently for female patients as well, if it's performed by experienced hands of the surgical team, doctor, and the clinic.